Welcome back and welcome to Health and Nutrition. This is a conversation between Dr. Lalita Kaul, a professor at College of Medicine, Howard University, and Dr. Shambhu Banik. Here, these two renowned personalities will talk to us about hypertension, or what we call high blood pressure. Let's see.
Good morning. Welcome to Global Television Network's Women and World Views Health and Nutrition segment. This morning, we are very pleased to have with us Professor Lalita Kaul, who has been Professor of Nutrition, Health in Howard University for 3 decades. Professor Kaul, welcome to Global Television Network's Women's and World Views Health and Nutrition program.
Thank you. It's a pleasure to be here.
This morning, we'll be talking about hypertension. As you know, the hypertension is one of the number one issue among other issues in this country. What is hypertension?
Hypertension is every time a heart beats, there's a pressure in the arteries, which take the blood supply to the body, and that is your systolic, and then the diastolic is the pressure between the two beats. So what happens is there are several kinds of hypertension. One is called essential hypertension, and sometimes it's called silent killer. And you go to the doctor and say, oh, your blood pressure is high. He or she doesn't know, is it white coat syndrome? That means you're scared. And
What coat syndrome?
it's called white coat syndrome.
Yeah.
If a doctor is wearing, not all doctors wear white coat, and
No, I
you get
see.
very apprehensive.
I see.
So blood
Okay.
pressure, or of course the doctor has a history. If you have family history, if you are overweight, if you are smoking, and of course he or she will decide whether to put you on medication or do lifestyle changes to monitor it for a few months. And depends again age and the history. So that is essential, that is primary. You just found out, or you went to a grocery store, your blood pressure has been consistently running, or you are having headache, your neck is high, and you go, and one of the things doctor wants to find out is it due to hypertension, hypoglycemia, hyperglycemia, before he goes to very fancy tests. And then there is hypertension due to secondary reasons. Might be having patient problem with kidneys or some other organs, excuse me, or some medications. So of course the doctor will treat the cause and accordingly treat medically. But where the licensed nutritionist comes is looks at your diet and modifies your environmental factors in conjunction with medications and improving your lifestyles.
What is the normal blood pressure, and whom would you call the person who is suffering from hypertension? You said the high blood pressure.
Well, normally according to American Heart Association, 120 systolic and 80 diastolic pressure is normal, but now the new guidelines are saying even 115 over 75. But you have to look at the age of the person, and then we have pre-hypertension where it might be 130 over 90, and we go through different stages when it's extreme, very high. And of course your physician will decide what kind of medications to take. As we get older, our systolic, that's your higher number, starts getting higher. And at one time, we didn't pay attention. They say it's part of aging process. You might see some elderly people having 160 or 75. And of course, the doctor will decide now their specific medication to bring it down. And then with age, you may not get the perfect 120 or 80, but the doctor has the guidelines, okay, it's okay. but the lifestyle changes would help improve to bring your blood pressure within normal range.
You mentioned even in the previous sections lifestyles. Could you tell our viewers what do you mean by lifestyle changes in case of lowering high blood pressure?
There are several lifestyle changes you can do on your own, or you can go to a licensed nutritionist. You can do, first is if you are overweight or obese, you need to bring your weight down. It doesn't have to be ideal. If you are 250, it's very difficult to come to the ideal 130, but something which is comfortable to you, which you have been. I usually ask my patients, if he is 50, how much did you weigh 40 when you were 30, and if he has never been less than 150, and I tell my medical students too, then it is not expectable to them, but even if they make 10% changes, it will affect their blood pressure, their glucose, their medications, and they feel so happy. And so the first will be weight, and the second will be exercise. Again, you modify it according to the individual lifestyle, what kind of exercise. And the third is if the patient is smoking. Smoking is very crucial in especially hypertension. Then is alcohol, how much you are drinking. And then of course your daily activity, what kind of diet you are eating, especially in hypertension, low salt diet. Even though we have diuretics which lower your, by cutting the pressure,
Right.
but still you need to follow the diet. When we didn't have diuretics, what did they do? Doctors put the patients on vegetable and rice diet called Campner's diet, but they don't have salt. So that's all you're going to eat. We don't have medication. Their blood pressure dropped. They started, because the salt holds the water, and here you have edema or built-up of water. So the low salt diet, even if you are taking diuretics, some patients believe, well, I'm taking diuretics, so I can eat everything. But you have to be, the highest are the canned foods. Now what do you do? Some of the people in low income families whom I see, they say it's cheap, the shelf life is longer. And well, the next best is to get the frozen. Of course, the best will be the fresh. So I try to modify. So then there are hidden sodiums, which we don't think of. Your ketchup, your olives, your relish, your mustard, all these, your salad dressing. You go to salad bar, you said, why do I come so bloated? And you have hypertension and all. Well, if you look how much all this, even oil and vinegar, how much sodium there is. So the sodium, cutting down the fat, because eventually hypertension can lead to other conditions of the heart. So lifestyle changes and the medications, if your doctor wants you to go along, are very important for having a good quality of life.
Okay. Why so many Indian Americans are having hypertension?
Same as I have seen many in my practice and socially, they are obese. And they are. Again, I say you don't have to be ideal weight like 130 you were 30 years ago, even if you drop 10%. Same thing, activity, cut down on your alcohol, cut down on your fried foods. You can take it occasionally if you are going celebration. That's what I tell my patients, you don't have to be watching. You can just, I have guidelines in my book about eating in the restaurant. As you know, restaurant foods are very high in sodium and fat. They are very tasty. Even French food is so tasty, but they have this French butter. So what modification can you make? But once in a while, enjoy. If it's wedding, if it's birthday, then come back on your lifestyle changes.
How about pakoras?
Pakoras is enjoy to eat it unless you eat it every day. But you're having a social, enjoy it, eat it, and then go back to your thing. So when I give a diet to the patient, my diet includes even the foods you love and enjoy, whether it's pakoras or dessert, it's part of your meal. So you don't, when they leave my office, they say, it's not a diet. I can make the adjustment. I recommend very minor adjustment. So over a period of time, they become part of you. And the doctor decides you want to give medication or not.
Professor Kaul, what are some of the serious consequences of uncontrolled hypertension?
Oh, very serious. Of course, it's uncontrolled. Sometimes your doctor has to use 3-4 medications to control it. I know cases where, the serious consequences immediately is your heart, because there's so much pressure on the heart. And as a result, the doctors know that you can have heart enlargement, you can have congestive heart failure because you are retaining water. You can get arrhythmia, your heart is not beating, then you can have fast heartbeat. So it's so much load for the heart. So if heart is not pumping enough blood to the body, then it's going to affect your lungs, your kidneys. And so it's very, very important to nip it in the bud with the help of your physician and your nutritionist in combination.
Would you also comment on the sodium content of foods in this country?
Sodium content of the food is very high, and sometimes, and that's fast foods. I love it. I go and eat. I enjoy it. Sodium content is very high in ready-made foods, like in vending machines. Like students or anybody, you're in a hurry, you want to put the coins, press potato chips. I have done it. It's okay, occasionally you do. And anytime you make very strict rules, I tell my friends, they ask me, if you make very strict crash diets, you crash. You don't care. If you are happy, you want to enjoy. If you're sad, I don't care. I don't care. I want that food. So sodium content is very high, and most of the time we can eat at home, and we don't have to shake our salt shakers all the time. You can use it, and some people eat even without tasting. They have to shake the salt. And also I want to make a caution, some people who take salt substitutes, usually these substitutes are high in potassium, so you must consult your physician your potassium level. Because that's another issue. If your potassium is high or if it is low, then low potassium can affect your heart. So as I tell my students, our body is yellow, green and red light, and if one light goes off, there is chaos.
Boy, this morning you have enlightened us with so many factors affecting hypertension or lifestyle, Can you briefly, because we have got very short period of time now, in 30 seconds, what can we do to improve this blood pressure level being too high?
As I said again, lifestyle changes. Of course, consult your physician, and he or she will decide whether you need medication. But lifestyle is same, your exercise, your weight, your salt, and many studies have come till yesterday called DASH diet to improve hypertension. Is fruits, vegetables. In fact, Dr. Ornishan, he has reversed heart disease in his clinic just by diet and lifestyle changes.
Fruits and vegetables?
No, you eat whole grains, fruits, vegetables, no meat, meditation, and other lifestyle change. You have to get your diet to 20%. We in America take about over 30%, and our goal, American Heart, is to bring it to we used to be 40%, we have come down to 35, but it's still way high.
How about yoga?
Very good, excellent. Yoga, meditation, all these alternative methods are very good for hypertension, and it will.
Well, thank you very much for coming this morning and enlightening us on different topics on health and nutrition, especially hypertension is such a issue. Lots of Indian Americans and Americans suffer from that. So thank you very much for sharing your ideas and thoughts with us.
Thank you, it's a pleasure.